Why is persistent HPV infection important after an HPV test? Imagine getting an HPV test and finding out you have a high-risk type of the virus. Now, you might wonder why doctors focus so much on whether the infection sticks around. Well, persistent infection with high-risk human papillomavirus is a key factor in the development of cervical cancer and other reproductive cancers. While many HPV infections clear up on their own within a couple of years, some infections stay in the body longer. When the same high-risk HPV type persists, it can cause changes in the cells of the cervix that might become precancerous over time. If these changes are not caught early, they could develop into invasive cancer. That's why knowing whether the infection persists is so important. When a woman tests positive for HPV, it shows she has the virus, but it doesn't mean she will develop cancer. Many infections resolve naturally. However, if the infection remains, especially with high-risk types like HPV 16 or 18, it increases the risk of cellular changes that can lead to cervical cancer. Persistent infection causes alterations in cervical cells, creating a condition called cervical intraepithelial neoplasia, which is a precancerous state. Detecting this early through follow-up testing allows healthcare providers to monitor and intervene before it becomes more serious. The immune system plays a big role here. Sometimes, the body's immune response isn't strong enough to clear the virus, especially in older women. Persistent HPV infection may also indicate that the virus has integrated into the host cells, increasing the chance of abnormal cell growth. That's why age matters. Younger women often clear the virus more effectively, while older women are more likely to have persistent infections that could lead to problems. After treatment for precancerous lesions, ongoing monitoring is essential. If the HPV infection persists or comes back, it can lead to new lesions or even cancer. That's why regular follow-up testing is recommended for many years after treatment. It helps catch any recurrence early and ensures the health of the cervix. It's important to remember that high-risk HPV infections aren't limited to cervical cancer. They are also linked to other reproductive cancers like those of the vulva, vagina, penis, and even some head and neck cancers. Monitoring whether the infection persists helps in managing the risk across these areas too. Clinically, knowing if the HPV infection persists guides healthcare decisions. It helps determine whether a patient needs closer surveillance, additional tests like colposcopy, or possible treatment. If the infection clears, it reduces the need for invasive procedures. But if it persists, early action can prevent the progression to cancer. In summary, persistent HPV infection after an HPV test is a crucial warning sign. It indicates an increased risk of developing cervical and other reproductive cancers. Recognizing persistence allows doctors to tailor screening and follow-up plans, catching potential problems early. Regular screening with HPV testing and appropriate follow-up are vital tools in preventing cancer and protecting health. If you have concerns about HPV or your screening results, always consult your healthcare provider for personalized advice and care.